Well, thank you for coming back. You are most welcome to this video and talk. It is Sunday the 24th of January. Now, I do hope you got a chance to watch yesterday's video on the fears that I have about the new variant growing in various parts of the world, including the United States, and we already saw that it was growing in some European countries, which acted as a model and an early warning for the United States, really, a sort of canary in the coal mine, if you like. But today I want to focus on vaccines and a few things that's going on with vaccination, because vaccination is our way out of this. I'm not going to give you lots of facts and figures today. It's a Sunday, so we'll take it a bit easy. But there's some important principles to look at. Now, Professor Prof Van-Tam is the Deputy Chief Medical Officer in the UK. I think he's for England. I think the Scots and Welsh and Northern Irish have their own. But anyway, he's a senior medical speaker. And basically what he's been saying is that if you've had the vaccine, it's still possible that you could pass COVID-19 on to other people. You could still be transmissible. Now, I think this has been taken out of context by quite a few people. He's not actually saying that we now know that people that are vaccinated still pass the virus on. He's actually saying we don't know, therefore we should assume, it's safe to assume that they do. That's the only safe way to go. So that's actually what he's saying. Quite a lot of misunderstanding about that. So I just wanted to clarify that. It's on quite a few news outlets. So people who've had the vaccine could still pass the virus on to others, he's saying, should continue to follow all the rules, zero behavioural change. Now, this is the point. He's saying when there's things we don't know, we need to err on the side of caution. And of course, he is 100% correct on this. We cannot change our behaviours. Now, pretty soon, I would think in the next couple of weeks, we should get good phase 4 data on the vaccines. That's the data that's collected after the vaccines are released, because there's still lots of data being collected. And I believe quite firmly that will show a significant reduction in transmissibility in those who've been vaccinated, especially those who've had 2 doses of the vaccine. Now, to what degree the transmissibility will be reduced, we don't know. I suspect it's going to be significant. If Dr Van-Tam knows, he's certainly not saying, but the reason he's not saying is he wants people to err on the side of caution, and I do too. I agree 100% with him. Now, if new data comes along later on that says we can ease precautions if we've been vaccinated, so be it, but we are not there yet. This is the vital point he is making, and I am pleased to reinforce that. So he says, carry on as if you have the virus. You could still be spreading the virus. Could be, maybe less, but you could be. So we have to assume that we are till we have the data. We don't yet know the impact of the vaccine on transmission. Again, completely correct. No vaccine's ever been 100% effective. Again, completely correct. So it may be that it reduces transmission by 90%. We simply don't know. So we have to carry on exactly as we were. Possible to contract the virus 2 to 3 weeks after vaccination. Now, he is somewhat contradicting himself here. Well, no, he's not actually. He's saying you can contract the virus for 2 to 3 weeks after. So when someone's been vaccinated, there must be no behavioural change ever. But if someone's been vaccinated, just as an academic exercise, not that it has any behavioural implications, it's worth knowing that the immune response takes 2 weeks to build up after vaccination, and in older people it takes 3 weeks to build up after injection. So about 2 weeks to build up a reasonable immune response in younger people, about 3 weeks in older people after the first dose of the vaccine. We still know that's not as good as 2 doses of the vaccine, but even knowing that, it mustn't change our behaviour, is what he's saying. And we agree. Better to allow at least 3 weeks in older people. So after 3 weeks, older people can have a degree of peace of mind, is I believe what he's saying, but that must not change their behaviour. Transmission possible after 2 doses. Possibly that will turn out to be the case. We'll know soon. I suspect it to be much less, but because we don't know, we are on the side of caution, because we are in an emergency situation in this pandemic. Now, the British Medical Association. And I think you'll see the principles we're talking about here apply everywhere, regardless of which country you're in. The British Medical Association, talking specifically, it must be said, about the Pfizer-BioNTech vaccine. They are not talking about the Oxford-AstraZeneca vaccine. Their comments were specific to this vaccine. 12 weeks policy, that's the 12 weeks between the first and the second dose, difficult to justify, they say. And they want the gap reduced to 6 weeks. Sounds great. I would also like to prioritise, I'd like to vaccinate all at-risk groups. I'd like to vaccinate the police, teachers, shop workers, all healthcare providers, anyone with a health condition which may predispose them to the virus, and I'd like to be vaccinated as well. But we can't all be vaccinated at the same time. This is the whole point. This is why we are doing this one vaccine strategy, to try and keep people out of hospital. As far as we know, the Oxford vaccine keeps 100% of people out of hospital. As far as we know, the Pfizer vaccine, the Pfizer-BioNTech vaccine, keeps 90% of people out of hospital. This is what we need to do because of the rush on hospital. So it's all very nice sitting there. It's difficult to justify from an armchair position, but Professor Van-Tam and his colleagues have to make the decision, and that's a bit harder. But Professor Van-Tam hit back actually, saying what none of these will tell me is who on the at-risk list should suffer slower access to their first dose so that someone else who's already had one dose can get a second. So there's no point saying, well, I would like John Campbell to be vaccinated, because if I say that, I have to say, oh, but that means that Barry Jones down the road can't get vaccinated, because we have a limited supply. So I believe the UK government is taking the right approach at the moment. I can see the rationale for it. We need to keep people out of hospital. As I've said many times, I don't mind getting a little bit sick, but I don't want to get very sick. I don't want to be hospitalised, and I certainly don't want to die. And that's what one dose of the vaccine does, according to the data that we have from phase 3 clinical trials, the best data at the moment. So I agree completely with the government policy. Now, if evidence comes along to change that, then we'll change it. But, to say academically, oh, well, I think it would be better to give it every 6. Of course it might. Well, it may well be. It may well be. But for the Pfizer-BioNTech, less so for the Oxford. The longer gap does seem to increase the efficacy of the Oxford vaccine, actually. But, to say that is one thing, but to actually look at someone in the eye and say, look, you are not getting your vaccine now because someone else is getting two. It really brings it home, doesn't it? I get emails all the time saying this group and that group should be prioritised, but that means you deprioritise another group. Which is that going to be? I would say you don't have the right to say a group should be prioritised without saying who's going to be deprioritised and delayed, because that's what this is about. Now, a couple of national disgraces. Don't really like doing our national dirty washing in public, but it's necessary at this moment. Now, there was a rumour that there was 400 people at a wedding in London. It looks like it's nearer 150, but it may be that quite a few, as we say in the UK, legged it before the police arrived. It was at Stamford Hill. It was last Thursday. Now, apparently what this lot had done for this wedding, so they wanted to follow normal cultural practice. Now, of course, we all want to follow normal cultural practice, but they have to be suspended at the moment. I'm not following my normal cultural practices. They're suspended. But this group apparently rented a school, boarded up the windows so no one could see them. Then how many? 150, 200? We believe 150 at least, all piled in and started having a party for this wedding. I mean, it's funny if it wasn't so serious. I mean, this could have been a super spreader event on unprecedented proportions that caused many to die because one particular group wants to carry on with their culture. Well, you can't. That's what the law says, and the police broke it up. Organisers face a £10,000 fine. I would hope that's going to be applied. Hope individual guests are going to be fined as well. I mean, it's such flagrant breaking of the law. And the school principal, I think the school had nothing to do with this, although you could argue they didn't have due diligence as to what was going on in their property. But the school principal died from COVID in April. So there's been a few incidences of this around the UK, and it's just completely unacceptable. Completely unacceptable. Cultural practices, in many ways, suspended. Get married by all means. Marriage is fine. Do it, but do it within the COVID law. Is the current situation. Another UK disgrace. Now, this is reported by the BBC. Apparently, in North Wales, Some council staff book vaccine appointments following a link on an email only intended for the recipient. So it looks like in North Wales, some council staff have basically hijacked emails to book themselves in for early vaccination. Now, whether any vaccines were actually carried out or whether they're all picked up, in a sense, doesn't matter. This is just absolutely disgraceful. Absolutely disgraceful. So that was reported by the BBC. This really is, you know what this is? This is cowardice in the face of the enemy. This is saying, look, you suffer as long as I'm okay. You know, emergencies bring out the best in people, but they can bring out the worst in people as well. They really can. And these are just, thankfully, we looked at so many examples of this emergency bringing out the best in people. But this is the worst. So bad news. Well, nothing more to say about that really, is it's just a disgrace. Joint Committee on Vaccination, Immunisation and Priority List must be followed in the UK. And this is it. So we've got 1 residents in care homes for older and adults. So that's the priority group there. 2 80-year-olds and over frontline healthcare. Social care workers, 75-year-olds is 3, 4, and it goes on down. It goes on down the list. Now, I think the plan is to get to here. I think the plan is to get. Let me just load this graphic so we can see this. Here we are. This is the schedule for the United Kingdom. So they want to reach this 15 million mark by mid-February, basically as early as possible. So we would need a rate of 384,000 vaccines per day to reach 15 million by, when's that? By about the 15th of February. 15th of February. If we vaccinate at the lower rate, we'll only get to here. And this 15 million target includes all over 70s care and residents and workers and other healthcare social workers and clinically extremely vulnerable people. So the aim is to get to here, to get to there by the 15th of February. So that's the government aim, to get to there by the 15th of February. And to do that, they will need to vaccinate, to reach that target, 384,676 people per day to reach that by the 15th of February. If they're doing a low 7-day average, 306,000, then they'll only get to 13.1 million by the 15th of February. So that is the UK aim, to get to there. And then we'll go on. 5 will be 65 plus. Then we'll go into group 6, 7, 8, and 9. And then, of course, on to the rest of the population. Now, the whole government strategy in this is to vaccinate those that are most likely to be hospitalised first, most likely to get sick, most likely to die, therefore reduce hospitalisations and reduce deaths. That is the underlying position of the government. Now, Philippines, for example, took a different course. They've sought to priority vaccinate those who are most likely to spread the infection. I can see where they're coming from, but you know, we either have government or we have anarchy, and that's what we've decided to do in the UK. So I believe it's our duty to support that. Now, Europe situation. Serious vaccine supply issues. Very serious vaccine supply issues in Europe. Putting all these together, the kind of bottom line on this is that Europe are going to complete vaccinations later than the UK, probably later in the United States, and later than a lot of other countries. The vaccination programme in Europe is not going well. So I'll put the links on the description. You can cruise around all those vaccination tracker sites that we've looked at before. I'm not going to do them today, but Europe's not going well, and this has got huge implications for the well-being of people. It's got huge economic implications, but as well as that, the key thing is that the new variant is not waiting. The the new variants are becoming more prevalent, and the new variants are spreading quicker than vaccination is. So infection versus injections. In Europe, the infection is probably going to win in quite a few areas because of these wretched new, more transmissible strains. So the implications are huge, I'm afraid, for the rest of this winter into spring for Europe, and it's a great tragedy. European Union area joint vaccination strategy aimed to ensure equitable access across the bloc. So that sounds good. Hard to disagree with that. We would agree with that. But how's it working out in practice? Well, Pfizer-BioNTech has ordered 600 million doses. Pfizer deliveries are down 50% to some European countries this week because they're doing work to increase capacity at its Belgium processing plant, whereas most of it is made at the moment. Now, how quick this work's going to be done, what the implications will be for increased production, whether it's going to be massive increased production, we don't know, but it's delaying everything, and this is a delay we simply can't afford. Vaccination stopped areas in Germany, Poland, Italy have suspended their first jabs. People are bouncing up and down talking about legal action, but the doses simply aren't being produced. Vaccination of medics in Madrid has unfortunately stopped. So big areas, Germany, Poland, Italy, suspended first vaccinations. It's these first vaccinations that are so important to keep people out of hospital and save lives. So that's not good. Now, the Oxford AstraZeneca vaccine, not a lot better, really. Now, the EU's ordered 300 million doses, which is brilliant. But there's no emergency. The European Medicines Agency has not approved it yet. Why not? This is laughable. The delay is farcical. But in the first quarter, deliveries were due to be 8 million, the first quarter, that's January, February, March. Now down to 31 million, unfortunately. But if they approved it, at least they'd have that 31 million, which is a lot better than nothing. But even the Oxford AstraZeneca, the supplies aren't going to be where people hoped they would be. It's a cut of 60%. So 80 down to 31 million. So supplies of the Pfizer vaccine are down. Supplies of the Oxford AstraZeneca, which is being waited for, even when it is approved, when the European Medicines Agency get around to actually doing their day job, it's still going to be much reduced numbers that were hoped for, than were hoped for, which is a great pity. Now, the Moderna vaccine, what's happening with the Moderna vaccine in Europe? Approved on the 6th of January by the European Medicines Agency, brilliant. They've ordered 160 million. The delivery is this 160 million is going to be delivered between now and September. 80 million doses will 80 million people of the 448 million in the EU citizens would be vaccinated by that. So the 160 million doses would vaccinate 80 million people fully. But there's 448 million in the European Union area. And what is happening with the Moderna vaccine is really hard to find out. Now, I did spend about half an hour yesterday quite late last night, looking at this and actually finding how much of the Moderna vaccine has arrived in Europe and is being given out in Europe. I just couldn't find that information. So if you know that, do let me know. But it looks like a very slow start from the Moderna vaccine in Europe. So it looks like a very slow start from Moderna. Oxford AstraZeneca not yet approved, but scaled back to 31 million from 80 million, even when it is approved. And supplies of the Pfizer-BioNTech down by 50%. This is really quite catastrophic for Europe. It really is. This is major advantage to the new variants. Right, EU's Commissioner for Health and Food Safety. We're all in this together and united. And I remember Ursula von der Leyen saying when the first vaccine was given, it was a touching moment of international unity. Okay, well, this channel is not about politics, but we will interrogate whether that relates to reality or not, which is what we're into, the nature of reality. Is Hungary united? It's bought Sputnik's Russian Sputnik vaccine, which does not have European medicines approval. So theoretically, if you're in Europe, as of course Hungary is, you can only use a medication or a vaccine if it's approved by the European Medicines Agency. Sputnik 5, not the V's for vaccine. The Sputnik vaccine has not been approved, but Hungary's ordered very large amounts, we believe, to arrive in 3 tranches. So the Hungarian government moving to protect its own citizens, regardless of what the rest of the European bloc is doing. So somewhat inconsistent with we're all in this together and united. Germany. Germans are very unhappy about the economic situation. Of course, we all are. But they made a bilateral deal with Pfizer, just between Germans and Pfizer-BioNTech, for an extra 30 million doses, not related to the European Union at all. So basically, Germany is looking after the interests of its own citizens. GlaxoSmithKline Sanofi. Now, this is a real pity, this vaccine. This is the French, basically it's the French vaccine. The results were very poor in the over 50s in phase 3 clinical trials. Basically, the phase 3 clinical trials failed. The vaccine was not generating a good immune response. They've basically gone back to phase 2 trials now, phase 2, early phase 3. And it's not going to be here till the last quarter of 2021, not 2012. So massive delay. But the French are accusing the Germans. The French are saying that the Germans have said that the French are trying to delay, that the Germans should delay their vaccines and wait for this Sanofi vaccine, which of course is French and has got national pride associated with it. The French are denying they've asked for this delay, but the Germans have said they did ask for this delay. So just causing fights, it's just undignified. They need to get their act together, really. Anyway, Netherlands curfew, 9 p.m. to 4:30 a.m. Now, I've had so many reports from people saying they've seen youths hanging around in the evening. Often, even in this winter, you think it'd be too cold, but, just hanging around, drinking, socialising. Completely understandable, but also illegal at the moment. So Netherlands has introduced a curfew from 9 p.m, quite early, to 4:30 a.m. in the morning. And for Netherlands to introduce a curfew is a massive cultural thing because it relates to the 39-45 era. And it's a big thing for Netherlands to do that, but they've done it. And it makes sense that they've done it. Portugal, we looked at the way the graph in Portugal is going off the scale. I'm so sorry about this. It's just going off the scale in Portugal because of the new variant. Genomic testing, though, still catching up with that situation. Brazil suffered so badly. Very good news report from Al Jazeera. Check it out. Brazilian variant. Now, the Brazilian variant has arrived in Frankfurt from Brazil. So it's spreading round by international air travel. Thankfully, this one's been picked up. But on Thursday, someone flew in from Brazil to Frankfurt. They were asymptomatic. So it was only picked up by the preliminary chain reaction testing. Otherwise, they would have missed it. Good job they're doing that. Have others got through that weren't tested or didn't get detected for one reason or another? Perhaps because they were in the early stages of infection and did not have enough dose to trigger not having enough too early a stage of the infection to trigger the PCR test. Could mean that the Brazilian variant is currently spreading in Germany. We don't know. But these delays in vaccine are going to give it time. So why on earth we're still flying from Brazil to Germany, I don't know. Brazil itself awaiting 2 million Oxford AstraZeneca doses from India. Good news. India sending 2 million doses of vaccine directly to Brazil. Manaus in the Amazon has halted its vaccine program because it can't get any. And there are reports of corruption in the Al Jazeera news report, where people are basically paying to get the vaccine ahead of time. So important there because so many indigenous groups in the Amazon have suffered so badly from this, and they really do need to get the vaccine as quickly as they can because the death rate amongst some indigenous peoples is horrendous. And yet, some people are paying to get the vaccine for themselves. That means others will die. It's that simple. There's this corruption with massive implications. Rio de Janeiro Carnival completely cancelled, of course. Again, big cultural thing. They've made a massive cultural sacrifice. And it just shows that needs to be done. Next year, Carnival should be brilliant. Brazilian AstraZeneca. Now, Brazil has got a deal with that Oxford AstraZeneca vaccine. I remember the AstraZeneca vaccine and the Oxford University vaccine. It's been agreed it will be rolled out for the course of the pandemic free of profit. Oxford University and AstraZeneca are not making any money from this. But although they can make huge amounts, 100 million doses of this vaccine in Brazil, and about the same amount in Mexico, there's a delay in a particular ingredient from China. I don't know what it is, but there's a delay in that ingredient. That means the whole thing is stopped. So the only vaccines now getting into Brazil, well, there's a couple of sources, but the main one is the ready-made vaccines from India, which is tragic because Brazil can make its own vaccines. It's got good vaccine-making facility, as has Mexico, but they're lacking this ingredient from China. So hopefully for the Chinese authorities will get their act together, get that ingredient to Brazil, and then the Brazilians can make 100 million doses this year quite easily when they get the ingredient of the Oxford AstraZeneca, as can Mexico, which can transform South America, but we need that ingredient from China. There's some distribution of the Sinovac biotech, that's the Chinese vaccine. The efficacy of that in Brazil is low. I think from memory, was it 50% or was it 51% efficacy? Whatever it was very low, much lower than the Oxford vaccine. So there's some distribution of that, but I don't think it's the answer. I think the answer for South America is the Oxford vaccine. Right, I'm always taking longer than I thought, so we'll finish soon. India makes 6% of the world's vaccines. This is on a good year. So India is a huge vaccine superpower, and it's making the Covishield, what they call the Covishield, which is the AstraZeneca vaccine, which is brilliant. And they've sent 1.5 million doses to near neighbours Myanmar, country that used to be called Burma. So that is great to see, that the Indians are supplying vaccine to Brazil and Myanmar. Excellent. And this is a vaccine, of course, we know it works. But having done that, that's right, we're still on the good bit. This biotech firm, 24 years experience, 16 vaccines, exports to 123 countries, and they're making this vaccine, so that's good. And the Serum Institute of Vaccine in Pune in India as well. So India, lots of vaccine manufacturing capacity, lots of experience, good at it. Covishield, Serum Institute of India, the world's largest vaccine manufacturers, making 50 million doses a month. Excellent. 50 million doses a month. And when the Brazilians start making 100 million doses of their own, that's going to change South America, Central America. So Indians manufacturing, probably, world leading at the moment. So good job. India, emergency youth authorization for Covaxin. Now this is the other one about India, which is a bit more suspicious. It's an inactivated dead vaccine. So I'm sure you know the difference here. So the first vaccines were that you took some of the organism, you killed it, you injected it. The immune system recognises the dead form of the organism, makes a response to it, makes an antibody immunological response. So simple, should work. Trouble is we don't have much data on it yet, and the Indians have started doing it. So it's an inactivated dead vaccine, which is fine. It's dead, so it should be safe. Isolated by India's National Institute of Virology. So India's National Institute of Virology basically has brewed up lots of SARS coronavirus, 2 viruses, killed them, and they're injecting these into people. That is the vaccine. And that is how vaccines have been done for probably about more than 100 years now. The more modern ways are more sophisticated, but there's nothing wrong with that. It's tried, trusted, proved way of vaccinating. But this particular one, we don't know if it works, is the problem. Storage is great, normal fridge temperatures, no problem, bash it out all over the place. 2 shots 4 weeks apart. But we would like to know if it worked, really, before we start bashing it out. Restricted use in emergency situations in public interest as an abundant precaution. This is the bit no one understands, in clinical trial mode. So this vaccine is being given out in clinical trial mode. In other words, they're rolling it out and doing the clinical trials at the same time. Not new in this pandemic. China did that. Russia did that. And the Russian vaccine is starting to be used fairly widely. So I think we're getting full clinical trial data on that on May. I might be getting mixed up. But anyway, we will be getting data on it. But we don't. Not sure where the data is on the Russian one. But on this one, we don't have the data. Anyway, this is the Indian home brewed one. But people are saying there's an unmet medical need of serious and life-threatening disease in the country. So you can see why they're doing it. They are basically combining phase 3 clinical trials with the rollout. Oh, that's right. Now I'm getting confused with this one. They're going to have the efficacy data in by February. So just to clarify, that is that's this one, the Indian Covaxin. Where am I? That one, the Indian Covaxin. They're rolling it out now in clinical trial mode, combining the rollout with clinical trial, and we're expecting full efficacy data by February. So it's quite a few weeks into the rollout before we're going to get the data. But the Indian authorities are justifying it by saying we're in an emergency situation, which of course we are. Now, I'm going to have to stop soon because I'm going on far too long today. Prices per dose according to the BBC. Oxford AstraZeneca £3 per dose. It's about $4 US, $5 US. Moderna National Institutes of Health £25 per dose. That's the most expensive. Pfizer-BioNTech £15 per dose. That's the second most expensive. And the Sputnik vaccine $7.50 per dose. Moderna and Pfizer have both declared they are making a profit from this, which they are fully entitled to do. They are commercial companies. They are entitled to do that. Oxford AstraZeneca has declared it will not make a profit for the course of the pandemic, and that's reflected in the price of the vaccine. Therefore, the Oxford AstraZeneca vaccine is the big hope for poorer countries, especially once the super vaccine factory in the UK rolls into production. It will produce enough for the world, or a large part of the world. Combine that with a massive production in India, but it still means a lot of poor areas are not going to get vaccine in 2021. That's the reality of the situation, unless there's a major international collaboration getting this going. But there are signs of hope with increased production. And I suspect governments and security agencies around the world are thinking, hadn't we better have a vaccine producing capacity in Canada? Or the Canadians will be thinking that, and everyone will be thinking that for their own country. At least I certainly hope they are. Few sites, I'm not going to go on to them now. A few sites for you to look at. Global Vaccine Tracker that's a good one. UK Vaccine Tracker is that one. US Vaccine Tracker is that one. European Vaccine Tracker is that one. So do have a look around. I was going to do something else today on homeopathy, but I think we'll leave that till tomorrow. I will give you the bottom line on it, though. Anything to do with homeopathy is bunk. So always go by the advice of your doctor, and homeopathy is scientifically impossible. So we'll look at that tomorrow. Anyway, I think we'll leave it there today. Shall we show you some pictures? Right. Now this is from David in England, and we know that people who are guarding and protected are being given free supplies of vitamin D over winter, which is excellent. So this is like 3 months supply, I guess, more, whatever 120 days is. They're advising taking one of these a day. The dose is 400 international units, which is 10 micrograms of vitamin D, cholecalciferol. They're saying that's 200% of the recommended daily input, and I would say this dose is too low by quite a long way. So that's happening. Is that enough to make any difference? Probably not. Great missed opportunity. Is it better than nothing? Well, absolutely, it's better than nothing. And we're going to finish with a picture from Alice in Wiltshire, just purely because it looks nice, and it was a rainbow she took when she was out for a walk. There we go. So we'll finish on that. Thank you for that, Alice. That's us for today. It was going a bit longer than we meant to, but if you stayed about, thank you for staying. Some important points here about vaccination. Really has shown up how ill-prepared sophisticated countries, sophisticated blocks of countries were for this pandemic. And we knew that another pandemic was coming. We didn't know what form it was taking, and that was just basically ignored because everything was right for today. Why worry about what's going to go wrong next year? And now we're paying the consequences of that. I remember, for the last 30 years ago, I was teaching my students. You sitting in this classroom now will be involved in a pandemic. And I told generations of students that. They're probably all forgotten, but I did tell them that they would be involved, and now, of course, they are. We knew this was coming, and yet we were unprepared. Okay, that's all for today. Thank you for watching, of course, as always.